We are live, World of Wellness Weekend. I'm here, Mike Gallagher. I appreciate everybody coming down. And we have a lot of different things happening right now. Of course, we're talking on different health issues. We have free samples, free food, free information, all different types of ways we can help you folks. So, again, we encourage you to come on down 2419 Baldwick Road, World of Wellness. For those who can't be here, you can call in if you need to take advantage of all the deep specials and discounts. 412 922 9355. One more time, 412-922-9355. And so for those who don't know me, my name is Mike Gallagher. I'm a certified lifestyle educator. I've been in the industry for over 30 years. I work with all different types of practitioners, from medical doctors to hospitals to DOs to pharmacists to chiropractors to naturopaths to everybody in between. And so, no matter what program, and that's really what it is, it's not a pill, what program we decide to do, it is really all about the foundation. Of course, it starts with your food, and food can be your best friend or it can be your enemy. So, again, there's always food triggers that can play a role for inflammation. Obviously, sleep, very important. If we're not sleeping, we're not healing. The role stress plays, right? Obviously, there's other things that play a role with your, starting with the stomach. But again, a lot of people are dealing with pain and pain issues. It's one of the top reasons why people seek out doctors and need help with. And there's all different types of pain. So we're going to discuss all different aspects of natural solutions for pain. But at the same time, we know people always a lot of people turn to the medications, the drugs, right? And so again, we're not telling anybody to get off any drug. We want to be crystal clear with that. Always work with your doctor, your PCP, prescribing physician, who gave you those medications. They know your situation way better than we do. However, those can have some serious side effects, and not many people are aware of the dangers of those side effects. So I pulled up our website, which is fantastic. We've updated almost monthly now, all different types of information. So this is www.nutritionalfrontiers.com. Okay. So as we go through this presentation today on natural solutions for pain and inflammation, the first thing is we want people to be aware of the dangers of the medication. And some people are, some people aren't. So if you go to our education tab, okay, and we scroll down and we just click on consumer health alert tab, okay, and so there's all these different sections that we have on all different types of issues. But we're going to click on this one, the very first one, the dangers of over-the-counter pain medications. So when we're discussing this, again, we just want people to be aware. We want them to be knowledgeable. We want them to make empowered decisions about their health. And so when we look at the dangers of over the counter and prescription pain medications, this is not Mike Gallagher saying this. This is not World of Wellness saying this. This is not Nutritional Frontiers is saying this. Is two of the most prestigious medical journals in the world are actually saying these dangerous, scary statistics. And these are medical journals that all medical doctors refer to. And so it goes back to July of 1998. Look at this, 107,000 patients are hospitalized annually for taking a nonsteroidal anti-inflammatory. So that is Advil, that is Aleve, that is ibuprofen, folks. Okay, 107,000 a year. Okay, it goes on to say at least 16,500 NSAID related deaths occur each year with arthritis patients alone, right? So again, that is a very scary statistic. Okay. And this, by the way, this is prescription NSAIDs. They can't even track over the counter NSAIDs. Okay. And then a year later, June 99, New England Journal of Medicine basically saying the same exact thing. Conservative estimate 16,500 deaths occur. Again, with patients, this figure is similar to for autoimmune issues and Hodgkin's disease and cancers. Okay, so people know about cancer, but they really know about the dangers of taking that drug on an everyday, consistent basis. In fact, it goes on, this would be the 15th most common cause of death in the US, but yet this remains a silent epidemic. Many patients and physicians are really unaware of the true magnitude of the problem. Okay. And even though this is might be shocking to hear this for the first time, right? But we know the GI bleeding can occur from taking the NSAIDs. And we've seen studies where after just 3 days, GI bleeding can occur after taking an NSAID at prescribed dose. So this is an overdose, folks. This is at prescribed dose. And of course, we know it has liver issues, stresses out your liver, major liver issues going on here, right? So, um, again, this is just the United States, dude. This isn't even a worldwide figure. Continues to go on here, talks about how it affects on a biochemistry level. So we do have natural anti-inflammatory agents. The difference between a natural approach to pain inflammation versus a drug approach, the drug is blocking the mechanisms of inflammation. And yes, may work. Obviously, you feel the pain relief, but over time it causes other major issues. It blocks other mechanisms in your system. And that's what can lead to the GI bleeding and liver and everything else going on here, folks. Okay. So again, doctors might know about this, but they don't know anything else what to do. So they feel stuck, right? And so we're not even talking about Oxycontin, serious pain drugs. We're talking about basic things that people are using every day. So the first thing I always tell someone is, have you ever read the directions of your ibuprofen, of your Advil? And if you actually read what it says in fine print, sometimes we've got to break out the magnifying glass to read it. It says, do not take for more than 3 days in a row consecutively. It says it right on the directions. Okay. And we know people on it for 3 years consecutively every day, some even longer. All right. So it says it right on there, but most people aren't reading that. So we just want people to be aware of that first and foremost. Okay. So this is right on our website, folks. Anybody can read this. You can send this if this doesn't relate to you, maybe a family member, a friend, a neighbor. Okay. We just want them to be aware of the dangers of those medications. So now what? Right. So they'll say, well, what do we do? Right. I'm in pain. I can barely walk up the steps. I can barely do basic functional tasks. Just walking is painful. What can we do? So the good news is we've spent a lot of time and energy and research testing these natural formulas. And the technology has evolved through the years tremendously. So now we're at the point where we can have ingredients that the doctors who are discovering them are nominated for Nobel Prizes. And this is one of those type of ingredients. So we came out with this formula last year. SPM stands for Specialized Pro-Resolving Mediators. The doctor who discovered this is Dr. Serhan, Serhan. He's a PhD biochemist from Harvard, all right? And Dr. Serhan was nominated for Nobel Prize on this. This is the newest of the new in the world of natural anti-inflammatories. But even though it's new, there's over 1,800 published medical studies on the benefits of this one ingredient alone. And I can say in 30 years, I've never seen what this can do. Okay. And we'll talk about some case studies here in a minute. But this SPM stands for this very long sounding name, Specialized Pro Resolving Mediators. So let's dive deep into it. So we're talking all different types of pain, but especially, I would say, systemic inflammation, chronic inflammation, right? Chronic arthritis. Okay. So where this actually originates from is omega-3s. So how this all came about was Dr. Serhan was trying to figure out why and how omega-3s work, fish oil. So we've known about the benefits of them since the 1960s, okay? And there's hundreds of studies on omega-3 fish oil if you take the right amount at the right dosage, okay, which generally speaking is 2 grams a day of EPA DHA per serving. So that would be 3 soft gels of our omega-3D or 1 teaspoon of our liquid. Again, this is one of the highest concentrates of fish oil. If we go to a chain store retail market, they usually use very little of EPA DHA. So again, you have to take a lot more. So that's one big difference there, even just on regular fish oil. But we've known about the benefits of omegas: pain, brain, heart, eyes, skin, hair, hormone, immune, and oh, by the way, 500 other benefits of fish oil, right? But this doctor was trying to dig deeper. So originally what he found was in animal studies and mice studies, he found that the healthiest mice made the most abundant amounts of these SPMs. And the sickest mice, the oldest mice, the fattest mice made very little of these SPMs. So he was initially, what he did was he injected or extracted, I should rather say, extracted these SPMs from the healthy mice and injected it into the sick mice. And within days, they got better. And he couldn't believe it. So then he hypothesized this the same thing happened in humans. And what he found is yes, now it took him 20 years of research to figure this out. But yes, every mammal on the planet makes SPMs. Okay. In fact, if you read that first paragraph there, right? Abundant amounts, bloodstream, nervous system tissue, and even breast milk. Okay. So new mothers, when babies are born, they make abundant amounts of SPM being passed on, should be passed on to their babies. So this is another reason why they should be nursing, not baby formula, because they're getting the SPMs, right? And also because of this, SPMs are very safe for pregnant women and nursing women. And so that is another way you can use this if you have someone in the family who's pregnant and dealing with pain and inflammation. Normally, we're very limited on what we can recommend, but you can recommend SPMs very safely. So now, the other part of this, once he figured out that every mammal makes it, then how do you make it into a supplement? And so this is the final part of this process. This took him another several years. So we have to extract it from omega-3 fish oil, but it's actually a 3-step process. So we take the fish oil and we have to extract it into pre-resolving mediators. That's one step. And then the next step is into these pro-resolving mediators. So again, I commonly will say SPM is like fish oil on steroids, but somebody will usually ask me at that point, well, can I just take more fish oil? And the answer is no. You do not get what you can get from SPMs. In fact, physically impossible amounts that you would never be able to consume what you can get taking SPMs. Okay, so, but to the average person, we would just say SPMs are like fish oil on steroids or next generation fish oil or fish oil squared. But we get the point here. It takes fish oil to a whole nother level. Okay. So let's go down to some other facts here, what we're looking at. So again, this is where we get into a little bit more of the biochemistry, the science behind it. So they do not block the vital initial inflammatory response to trauma. And folks, that's what drugs do. Drugs block. This does not block. Okay, that's the big difference between supplements, natural health versus the drug approach and the drug model. It prevents excessive inflammation and promotes tissue homeostasis duration by controlling that inflammation. They are basically resolving mediators because they resolve naturally all the inflammatory responses. Now, we can break these down into 4 subcategories: resolvins, hypoxins, protectants, resins. But again, think about it like this. Each one of these has a special skill set. So resolvins might be better for your heart. Lipoxins might be better for your brain. The protectants might be better for your muscles. So each one, but we are using all of them. Okay. But so again, all inflammatory issues, this should help. There's another incredible benefit of SPMs as well, and that it helps regulate and mediate white blood cells. So they actually increase and boost your immune system. In fact, there's been several published studies with this with COVID. If you're going through COVID right now or have anybody in your family dealing with that, SPMs can actually reduce the magnitude of COVID. It can reduce the cytokine storm, is what they classify it as. It also can dramatically help people if they have post-COVID symptoms. They classify these as long hauler situations now, is how they term this, especially brain fog, memory, things like this, as well as lung issues. If you still have that nagging cough that you cannot shake, we've had incredible case success studies with SPMs using it for those kind of issues. Okay. Now, if someone is dealing with those, we would recommend a temporary loading dose, and that would be 6 a day. All right, with the soft gels. So let's break that down, like 2 breakfast, 2 lunch, 2 supper, or 3 and 3, 3 breakfast, 3 supper. Okay, 6 a day. If you prefer a liquid, we now have a liquid. We are the first to introduce a liquid SPM in the market. 1 teaspoon equals 2 soft gels. Okay, so it'll be teaspoon, breakfast, lunch, and supper. Once that condition is 100% better, then we would reduce it down to 2 soft gels a day until we finish the bottle. But again, we can't make any claims here, but I can tell you that just working with hundreds of practitioners around the country, that usually within a week, 7 days at 6 a day of the SPM, it works every time. In fact, I've never seen it not work. In fact, we've had people with brain fog issues due to COVID that in 1 day they felt better. Okay. So again, this is another way that you can use this is for people who are suffering from COVID situations. All right. But if we go back to the pain and inflammation side, by the way, it's very interesting. It also helps stimulate tissue regeneration, something that no drug, folks, no drug will be able to do this. Okay. And again, there's all different types of issues that we're looking at here that it's been shown to help with. So if we go up, arthritis, colitis, kidney issues, periodontal issues, asthma, but folks, everything, including cancer. And I mentioned again, boosting your immune system. There are over 150 published medical studies that SPMs can help with cancer. And again, always work with your physician with this. It's one piece of a large puzzle, but a very important piece that it can also help with. All right. So now let's just talk about the dosage of this. So if you're in pain right now, my question to you is, give me a number from 1 to 10. 10 being the most excruciating pain there is. Okay. And we want this to be a functional test question. So, meaning if we're talking about knee pain or back pain, for example, walking up or down the steps is a lot different than just walking regular, right? So, because again, when I first asked this question, people say, well, it's a 3. And then I said, well, what is it when you walk up the steps? Oh, it's an 8. So we go by that 8 number. Okay. Or if it's down the steps, if that's the issue. All right. So we go by that high number. If the number is 5 or higher, 5 to 10 on the pain scale, we recommend a temporary loading dose. And again, it's that same dosage we just talked about with the COVID situation. It's 6 a day. Again, temporary is the key word, temporary loading dose. We need to be aggressively get it into your system that calms down the inflammation. Then once you feel the pain relief, once that's 7 or 8 is down to a 0, then we back it down to 2 a day. Okay. So 6 a day initially, down to 2 a day. If we do the liquid, 3 teaspoons a day, then we back it down to 1 teaspoon. It's that simple, folks. Now, again, I have the unique privilege of working with a lot of different types of clinics around the country. And, I can see firsthand out there what's working, what's not, and I pass that on to you guys every day, as well as other practitioners. But I can truly say that, like I said, when I don't just say this lightly, when I've seen things that I've never seen before in 30 years that I've seen with SPM work. And so my first case with this was when we first introduced this at another clinic that had a very large staff. And one of the staff members was in an automobile accident 20 years ago. And she's been in pain ever since. And they literally tried every supplement there is. And they tried a lot of different alternative things, and including even stem cell and surgery and all kinds of stuff. Nothing helped. Nothing. So I said, why don't you try this? You tried it all. Give this a chance. So she did. And her pain was like 8 out of 10 last 20 years. Okay. So she tried this within a week. 50% pain relief. Okay. 5-0. I said, great. Stick with it. Within a month, 100% pain relief. 20 years, 30 days. And that's what we see over and over again. If you take the right amount, that is really critical because the bottle says 2 a day. 2 a day is the maintenance dose, not if you have pain or inflammation. So most of the time when people are not getting any results with certain supplements, they're not taking the right amount. Now, I've seen other things. I've seen chiropractors with other automobile cases and motorcycle accidents, and nothing has worked that this has worked for. So it's worth trying. And that's all we can tell anybody. Try one bottle, and we'll know in one bottle if this works for you. We usually know in 3 to 5 days. But once that pain is back under control, then we back it down to 2 a day. Okay. Now, can you stay on this? Sure. You can stay on this forever if you want to. But typically, we would transition back to regular fish oil once we fixed you and you're better. Now, I would always recommend chiropractic adjustments as well, especially for back pain and overall, because it could be a simple adjustment. Your body could be out of alignment that's causing that pain inflammation. So obviously there's lots of other things, infrared sauna, which again we have here available, laser, what Dr. Phil uses, right? Lots of different things we can do here with pain. But again, for systemic pain issues, for cancer issues, for COVID issues and post-long hauler situations. And if we're looking at labs and lab tests, there's the number one inflammatory marker there is on a blood test is high sensitive C-reactive protein. Now, most doctors, believe it or not, don't even test for high sensitive. They just test C-reactive protein. Even though high sensitive has been out for several years, most doctors are not aware of high sensitive is even more accurate blood lab marker than C-reactive protein. But why do I bring that up? Because again, it's the number one inflammatory marker, number one. And the research is so strong with SPM that if you take SPM for 30 days and then you retest that blood test, looking at your high sensitive CRP, the research has shown it reduces it by 43%, folks. 43. There's nothing I've ever studied in 30 years that reduces CRP that fast. So again, we know a lot of doctors, that's all they look at is labs. That's all they focus on is blood lab tests. Great. This formula will prove to them that it does work if you do take it every single day for 30 days in a row. Okay? So that's, I think we covered that one pretty good. All right? So if you fit into that profile. Now, let's talk about an oldie but goodie, X-Flame. So this is one of our original formulas that we created 16 years ago, all right? And we've had tremendous success through it through the years. And what would I say? What's the biggest difference between X-Flame and SPM? This is more for acute pain, more structural pain, right? Versus SPM is more systemic pain. Okay. So there's the difference. Now, can you do both? Absolutely. So if you have both acute pain and chronic pain, I would recommend both. If you're on more hardcore drugs like Oxycontin and those kind of things, and you're trying to transition working with your doctor, I would recommend both. Okay. But this is a really still good one, folks. We've had tremendous success through the years with it. And again, what makes it unique is this patent nutrient called creselazine. All right, so let's go through what's in this. All right, so creselazine is a combination of omega fats. So again, fish oil combined with the pH buffer form of creatine. And creatine, a lot of people know about athletes using creatine in strength, but there's tremendous amount of research that creatine also reduces inflammation. So we were able to combine the combination of these. We fused these two together to create this very unique ingredient. How unique is it? Well, when we introduced this in 2008, it was brand new to the industry. It's a brand new supplement ingredient. That's how new it was. Okay. And so that is, and just this study, let's talk about this. So there's double blind placebo control on just this one ingredient, where comparing it to an NSAID, after 30 days, 80% of the people said it was just as good, if not better, than their NSAID. Okay. 8 out of 10 people. So I know when me and Jamie, when we looked at the study on this, we're like, wait a minute, this is too good to be true. Cannot believe that an all-natural supplement works just as good, if not better, than an NSAID. 8 out of 10 people. So the unique thing that we have here at the clinic is we did our own pilot trial on real world, real life people. Because when you ever look at these studies, you have some doubts. And we got exactly the same results, folks. Okay, so that was the aha moment that we know we need to use this. Okay, so this is one of the unique things that put us on the map in the industry, that was able to get us in holistic doctors who've used every other supplement, every other ingredient, except this one. They never heard of it because we introduced it into the industry. Okay, so we are pioneers in certain things, right? Now, the second most important ingredient in this is DMG, dimethylglycine. One of my favorite, if not my favorite ingredient of all time. And it has several patents. And one of the patents is it has a US patent to treat all inflammation. Okay? So think about that. All other supplements, right? So you see it here, may not intend to diagnose, treat, cure, prevent any disease. At the time, DMG had this US patent. Now the patent ran out, so we can't make that claim anymore. But at the time, we could actually say it had a patent to treat all inflammation. There's also benefits for cancer on it, a patent on that. And again, athletic performance. I mean, there's hundreds of studies on DMG. The other unique thing about DMG is your master methylizer. It will enhance anything that you combine it with. So all these other incredible ingredients, we're combining it with it to get the best results with it. Okay. So these two absolutely are the most important, but then we have other natural ingredients that are very well known: turmeric, natural herb, boswellia, right? All these have research, quercetin, rutin, luteolin as well. Okay. So they act as antihistamines. And before we had the Air Max, if people had allergy issues and asthma and lung issues, we recommended just X-Flame and people got great results. So if you have pain and lung issues, X-Flame will also help with both. We have a little bit of ginger in there as well and a little bit of cayenne in there to enhance it. All right. So you combine this all together in capsule or powder, right? So it's not just one thing, folks. 1, 2, 3, 4, 5, 6, 7, 8, right? 8. So it's really 8 supplements in one. So that's how we develop the whole entire line. We make the line deeper versus wider. And I don't know anybody who wants to take 8 different supplements, but they can take one thing. And so when you combine these together, that synergy makes them work even faster. Okay. Now, here's the trickiest part about this, again, is the dosage. So if you are in pain, any type of pain, we recommend with the X-Flame, we get the best clinical results if we do a temporary loading dose. And the temporary loading dose is 4 with breakfast, 4 with lunch, and 4 supper, 12 a day. Okay. Or if you prefer 6 and 6, 6 breakfast, 6 supper. Is that a lot? Yes. Okay. But the key word is temporary. Usually works in 3 to 5 days. Once you feel the pain relief, then we back it down to 4 a day, 2 and 2. Okay. But 99 times out of 100, when someone tells me X-Flame doesn't work, I ask, how did you take it? Oh, I took 2. No, folks. 2 does not work. Right. Oh, I took 4. Nope. It's 12. 12 for it to work. That is the magic number for this formula. Okay. Now, if you are sensitive to medications, you can always start slowly and introduce it better, into your system, week, day by day. It's going to be a little bit longer process for you to feel the benefit, but you can if you are, more cautious. Also, if your kids or anybody on 100 pounds, we would cut that dose in half to 6 caps a day, right? If you are 100 pounds. Now, we also have this in a powder, okay? So you just simply add cold water. Okay. You can add this to a protein smoothie. You can add this to any of our colors. Okay. You can add this to the HA Plus powder, which is incredible. Great 1-2 combination, which we'll talk about here next as well. But 1 scoop equals 4 capsules. So if we're doing the loading dose of the X-Flame powder, it's 3 scoops a day, 1 scoop breakfast, lunch, and supper. Once you feel it working, 100% relief, then we back it down to 1 scoop. Okay. So that's how we look at it more from an acute type of pain situation. Does that make sense, everybody? Okay. Now, that's still only half of the story. The other half is the rebuild. Okay. So what if you have a cartilage issue, right? Back, knees, neck, disc, right? Extremity, wrists, things like this. Okay. So putting out that pain inflammation is great. And yes, you feel pain relief, but then what? Right. So the then what is the rebuild. The rebuild is the rest of the story. So if you have these type of cartilage issues, knees and back, we want to recommend the HA Plus. Okay, so the HA Plus is one of our, again, flagship formulas. We've had it for a long time. We've had tremendous success with it. It's an oldie but goodie because it works, folks. It works. So we have a powder as well as a capsule. You can do either one. We'll talk about the difference here in a moment. But joint pain, cartilage issues on the rebuild. Okay. So we have a saying. The saying is we can't rebuild the house if the house is still on fire. So the X flame puts out the fire, the SPM puts out the fire, and then the HA plus, you're going to get much faster, quicker results. Okay. So what is the most unique ingredient in this? Is this ingredient right here, folks? BioCell collagen from chicken, yielding hyaluronic acid. It also has chondroitin sulfate in there as well. But here's the history of how these supplements came along. So in the 1980s came out glucosamine sulfate. Okay. And what the research has shown, if you take the right amount, 1,500 milligrams, and the right length of time, 3 months, and it is the right form, the sulfate form, that it does help about half the population. 50% of the population will feel it working, which is great if you are in the 50% that is working for. But what about if you're on the other side, the 50% that's not? So why doesn't it work? Because it's a very large molecule. And for some, it's hard to break down and absorb. And so in the 90s, came out hyaluronic acid. Hyaluronic acid is a precursor to glucosamine. Statistically speaking, it's a smaller molecule. About 75% of the population can absorb hyaluronic acid, but that still leaves 25% that can't. So in the 2000s, came out this unique patented trademarked form of hyaluronic acid called BioCell. Okay. And they were able to shrink the molecule size 600 times smaller. And therefore, 99.9% of the population can absorb this form. It's the most absorbable hyaluronic acid on the market. And there are many, many studies that shows this. And that's why we use it. It also consists of collagen as well. So people are saying, do you have a collagen supplement? Yes, we do. HA plus. It will also help out on the skin. And we'll talk about that more in a minute. Some of the new studies with that as well. So the plus part is that we added glucosamine and MSM to it, which will also help support your joints and cartilage to rebuild as well. Okay. So you have all those ingredients in it. Okay. Now, how do we recommend taking HA plus capsules? So the newest research on this, if you are in pain, okay, joint pain, cartilage, again, temporary loading dose, 8 capsules a day is what the research shows. So break that up for breakfast, for supper, until there's pain relief. Now, if you combine this with the X Flame or the SPM, you're going to get much faster, quicker results. If you just take HA plus as a pain reliever, it's going to take a lot longer, especially depending on how long you've had that pain, how severe it is, and what the size of the body part. So if it's extremities like wrists and hands and fingers, usually 2 weeks. But if it's knees and back and things like this, it takes at least 4 to 6 weeks if you're just using HA plus to reduce the pain. So this is why we want to try to bundle the X Flame or the SPM with the HA plus together to give you the fastest, quickest results. Okay, so hopefully that makes sense. Now, once you feel the pain relief, we back it down to 2 caps a day. Okay, so just like SPM, we back it down to 2. Once you feel relief with the X Flame, it's down to 4. With this one, down to 2. Okay, so temporary loading dose with the HA plus to rebuild that cartilage. So HA actually does 3 things. It actually helps reduce inflammation. It actually also lubricates your joints. Okay. It actually replenishes your synovial fluid, which is the layer of fluid between your bones and your joints. As you age or wear and tear or an injury, it causes that fluid to diminish. So hyaluronic acid actually replenishes that. That's usually within the first 2 to 4 weeks. And then after that, the rebuild starts. Okay. So what I see again with people is they don't take the right amount and they don't give it enough time for it to work. So a good general rule of thumb is give it 3 months to really give it a fair chance, especially the larger the body part and the more pain you're in. Now, the one caution with this, okay, the glucosamine sulfate in the capsules is derived from shellfish, okay? And so we just, it's not the shellfish that you are, the protein from shellfish that you are allergic to, okay? We want to emphasize this, but we know a lot of people are just focused on labels. So if you go into anaphylactic shock and you need an EpiPen, where your shellfish allergies are so bad, yeah, I understand this, but we just want to point this out that we've never had anybody that had allergic reaction to the capsules, even though the glucosamine is from shellfish, because it's not the protein that we're using, and that's what you're allergic to or sensitive to. But so we, came along with the powder version. The powder version is vegetarian. So if you are strict vegetarian, go with the powder. If you prefer liquids, go with the powder. You just add water, cold water to it, go with the powder. So the glucosamine, instead of shellfish, we're using a plant-based source of it there. Very unique. Okay. So if you're using the powder, we would recommend temporary loading dose if you're in pain, 3 scoops a day, just like the X-Flame powder would be 3 scoops a day. And as I mentioned before, if you take them together, it tastes really good with cold water. Okay. Once you feel the pain relief, back it down to 1 scoop. All right. So keep that in mind. The other benefit with the capsules is the skin benefits. It helps with increasing collagen. Okay. So the research has shown, if that is your focus, reducing fine lines and wrinkles, if you take 4 capsules of the HA Plus a day for 3 months, the studies have been shown to significantly reduce fine lines and wrinkles. And it has the most studies of any collagen hyaluronic acid capsule on the market. Okay. So not just for your joints, but also for your skin. So that is another way that you can use the HA Plus. All right. So we'll move on. Now, what if your issue is not cartilage issues? What if it's connective tissue, tendons, and ligament issues? So think strains, sprains, and shoulders. And by the way, folks, shoulders, very difficult to heal, very difficult to rebuild. Okay. And a lot of people turn to surgery. But I can tell you that we've had some incredible cases with this one supplement, this one formula, Green Lipid Muscle, for shoulder injuries that did require surgery, that all they did was take this along with chiropractic adjustments and they canceled their surgery. Okay. So green lipid is very unique. You might say, what the heck is this? Well, mussels. This is a mussel. So this is a shellfish. So if you are sensitive to shellfish or allergic, we wouldn't recommend it. But it is only one source in the world, and that is New Zealand, is where this comes from. And when we look what's in this, so it's really like, again, 7 supplements in one. It's naturally occurring amino acids, branch chains, minerals, omegas, glucosamine, chondroitin, right? All in one, and hyaluronic acid. They all make up this particular shellfish. And this is the only natural food product that we've ever seen, that I've ever seen in 30 years, that contains all of these supplements in one. Now, we're also using this patented trademark form of it now called Glyco Omega, which focuses on this particular um, aspect of it, glycoaminoglycans, which are the components of that cartilage and synovial fluid. And so this particular trademark form of it has the most abundant amounts of this one nutrient. Okay. And so tendons and ligaments, folks, right? Will it help with joint pain? Sure, it will. So if you had somebody with the torn meniscus, both tendon ligament issues and cartilage, I would recommend both HA and green lipid for the fastest, quickest results. All right. But for every other type of strain, sprain, and ligament issue, just using a green lipid would be fantastic. All right. So now, again, the dosage. All right. So we recommend a loading dose. The loading dose, if you have these type of issues, is 6 a day with food, right? So 2 breakfast, 2 lunch, 2 supper, or 3 and 3. Once you feel 100% better, or with shoulders, if you have 100% rotation, no issues with shoulder pain, then we back it down to 2 a day. Okay. So that's how we look at this from a dosage standpoint. That's how we position this versus the HA plus. Again, tendons, ligaments. A couple other things about this formula too as well. If you have rheumatoid arthritis, there are published studies on this ingredient that will help with rheumatoid. Again, it's one piece of the puzzle, but it's a very important piece. Thirdly, Baker's cyst. Okay, so if you are familiar with that, that's a cyst that's on the back of your knee. It's very painful. The medical doctor, allopathic doctor, all they would do is drain it. There's no drug that would help reduce it. Okay, and then usually comes back over time. So we've had some clinical cases. In fact, right here at the World of Wellness, there was a patient who had this Baker cyst, and we tried all these other supplements. Nothing was working. And I remember it's a female, and she said, she could barely walk. Is that painful, this cyst? And she said, well, it's affecting my tendons and ligaments now, and I can't bend my knee. And I said, well, why don't you just try the green lipid muscle? Because I know it will help you with your tendon and ligament pain. And she said, sure. So I saw her a couple months later, and she gave me a big hug. She's like, Mike, it's gone. I'm like, what's gone? The Baker cyst, 100% gone. So since that time, I've recommended this to other practitioners and doctors throughout the country, and it's worked every single time, folks. At 6 a day, it can actually shrink a Baker's cyst, and there's no drug in the world that can do that. Okay, so again, that's a very unique, isolated situation, but just wanted to share it in case anybody happens to run across that issue. Okay, and then last but not least, there's a different type of pain, and that is nerve pain, or what we like to say, neuropathy. And there's different types of nerve pain, and doctors are so quick to put people on gabapentin, otherwise known as Neurontin, but that is not a very safe drug, folks. In fact, if you read all the potential side effects of it, it actually starts to eat away at your brain, okay, over time, along with other things. It's not fixing anything either, right? So there's all different types of neuropathy. The most common is diabetic neuropathy, but there's other types. There's chemoneuropathy, peripheral neuropathy. There's spinal stenosis, which is, again, numbness and tingling there, right? Nerve damage on your spine that we've seen this work, okay? So this would be our go-to, our number one formula for any type of nerve issue, nerve damage, spinal issue, spinal stenosis, right? Carpal tunnel, any of those things we've had tremendous results with. All right, so what's in it? So alpha lipoic acid, biotin, B12. And again, folks, something you should always look for on the label. Are they using the active form of B12? The active form is methylcobalamin. A lot of companies use cyanocobalamin, CYNA. And I've been told there's just a little bit of cyanide in cyanocobalamin, just a little bit of poison. That's all. But if we went to a mass market chain store that starts with the letter W, and we looked at every single vitamin in that store, every single B12, they all use cyanocobalamin. Yeah, that's it, baby. Right? It is. Bingo. So again, folks, you get what you pay for. And I always remember Dr. Weiner said Walmart is a great place to buy your toiletries, not your vitamins. Always remember that. Okay, but you have that. You have what else we have in here? Your folate, again, very important. A lot of people have issues with breaking down folate. It's a genetic SNP called MTHFR, about estimated at least half the population, but they can absorb this one, folate, fourth generation form. But the most important ingredient in this is the very last one called benfotiamine. This is a unique type of B vitamin that has tremendous research to actually regenerate nerve cells. Okay, benfotiamine. And when you combine it with all these other ingredients, you get a heck of a formula. So, if this is you and you fit into this category, we recommend 6 a day. Again, temporary loading dose, 2, 2, and 2, or 3 and 3. We'll know in one bottle. We usually know in 3 to 5 days. We'll know if this is helping you. Once it is and you're 100% better, then we back it down to 2 a day. Okay. And I've had some incredible cases with this through the years, but I can say the most incredible was this one diabetic neuropathy case. A female, she's diabetic for many years. She had neuropathy where she could not feel her fingers or toes for over 20 years. 20 years. And when she did feel, it was very painful. So I'm talking to the doctor and I said, give this a chance. He said, okay. So she purchased this from the clinic on a Friday. Okay. They got a phone call on Monday. 3 days later, 100% better. 3 days, over 20 years, 3 days. Pretty cool when it works like that, right? So again, all we can say, give it a chance. Give it a chance. All right. So you know about the dangers now of the NSAIDs. Again, systemic inflammation, SPM, more acute type of pain, X-Flame, you can do both. For more serious pain issues, to rebuild the HA plus joint cartilage. If it's more tendon ligament, strain, sprain, shoulder, green lipid. If it's more nerve pain, nerve damage, neuropathies, folks. If you tried any of these at this dosage, we think you're going to have great success. Okay. Again, this is one piece of the puzzle. We do recommend chiropractic. We do recommend other modalities. Lots of different ways we can help. And I do recommend you come in, make an appointment with one of the doctors here, chiropractors. They let them help you, let them evaluate you, get you on the right course of action. Okay. So I'll leave it with the rest of the time. Phil, any questions? No questions. Does anybody here have any questions? Okay. Well, thank you, folks. Everything's on special. Give it a chance right now. Again, I'll be here the rest of the day. So if you have anyone to talk to me personally, let me know. All right. Thank you. God bless.